Today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today, April 15th, 2020, with a special COVID-19 daily briefing hosted by Lesroy Williams. Today's briefing will include special reports by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff Dr. Cameron Wilkinson. Tune in for today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today, April 15th, 2020, with a special COVID-19 daily briefing hosted by Lesroy Williams. Today's briefing will include special reports by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff Dr. Cameron Wilkinson. Tune in for today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today, April 15th, 2020, with a special COVID-19 daily briefing hosted by Lesroy Williams. Today's briefing will include special reports by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff Dr. Cameron Wilkinson. Tune in for today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today, April 15th, 2020, with a special COVID-19 daily briefing hosted by Lesroy Williams. Today's briefing will include special reports by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff Dr. Cameron Wilkinson. Tune in for today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today, April 15th, 2020, with a special COVID-19 daily briefing hosted by Lesroy Williams. Today's briefing will include special reports by Chief Medical Officer Dr. Hazel Laws, Medical Chief of Staff Dr. Cameron Wilkinson. Tune in for today's briefing at 5 p.m. sharp on all local radio, television, and social media outlets. The battle to save lives is on. Today,
Good evening and welcome to this special edition of the National Emergency Operations Center COVID-19 Daily Briefing for today, the 15th of April 2020. Thank you very much for joining us for this special edition of the briefing. Today I am joined by Medical Chief of Staff at the Joseph N. France General Hospital, Dr. Cameron Wilkinson, and Chief Medical Officer, Dr. Hazel Laws for St. Kitts and Nevis. Welcome, Dr. Wilkinson.
Thank you.
Welcome, Dr.
Thank
Laws.
you. Thank you, Mr. Williams.
I am the host of this daily briefing today, Lesroy Williams. This is the fourth interview in a series of interviews on the COVID-19 pandemic, which has been done by Dr. Laws and Dr. Wilkinson. The outbreak of COVID-19 in Wuhan, China in late 2019 has spread to over 203 countries and is a global pandemic. With unprecedented public health interventions, local transmission of SARS-CoV-2 appears now to have been contained in China. Multiple countries are now experiencing the first wave of the COVID-19 pandemic. Thus, gaining an understanding of how these interventions prevented the transmission of SARS-CoV-2 in China is urgent. As of Wednesday, 15 April 2020, at 3 p.m., the World Health Organization reports that there have been 914,916 confirmed cases of COVID-19 globally, with 123,010 deaths. To date, 239 persons have been tested with 14 confirmed positive, 188 confirmed negative, and 37 results pending with 0 deaths. There are currently 0 persons quarantined in a government facility, while 111 persons are quarantined at home. 14 persons remain in isolation. To date, 581 persons have been released from quarantine. And that is the situation report, the COVID-19 situation report for St. Kitts and Nevis. Now, Dr. Laws and Dr. Wilkinson, what lessons have we learned from the China experience?
Thank you, Mr. Williams, for this question. The lessons learned from the first cities affected in China outside the Wuhan city after the outbreak of COVID-19 were well documented in 2 large studies coming out of China. And so this afternoon we will attempt to summarize these lessons for you. 1, initially the case numbers were driven by imported cases. 2, later the numbers were driven by local transmission. And thirdly, a package of non-pharmaceutical interventions or non-medicinal interventions had the ability to contain the transmission, not only imported cases, but also local transmission. COVID-19 was contained by the implementation of interventions such as contact tracing, social distancing, and population behavioral changes, including avoiding physical greetings, maintaining physical distance from others, and practicing good hand hygiene.
That's why we also learned from the study that there are potential adverse consequences of premature relaxation of intervention, and such a decision might lead to an increased transmissibility of the disease, leading to a second wave of infection. Now, while interventions to control COVID-19 are in place, countries still need to work towards some sense of normalcy. We can't leave the country locked down forever. We also learned that the absence of herd immunity against COVID-19 suggests that counts could easily resurge if these interventions are relaxed and businesses, factories, operations, and school resumed. And I think in a previous interview, I explained what herd immunity is, meaning that if we have less than 90 or 95% of the population not immune to the disease, then the other 5 or 6 who are vulnerable, the disease can come in and cause spread within them. We also learned that you can have a second wave of COVID-19 transmission through the virus being reintroduced once we open the country to international travel. And so these are the lessons that were learned from the Wuhan study in China.
Yeah.
Now, Dr. Laws, we have heard the Prime Minister speak earlier today of lifting some of the curfew restrictions. What was your advice in reference to the decision to ease restrictions?
Okay, so Mr. Williams, my advice with the decision to ease restrictions was based on this. First and foremost, protecting human life and guided by what we already know about the virus and how it behaves.
Okay, Dr. Laws, so my next question to you is, what do we know about the virus that helped to guide our decision-making
Process. Okay, so the best answer to your question is for us to be reminded of what the Director General of the World Health Organization said in his remarks on April 13th. He said, "We know that COVID-19 spreads fast, and we know that it is deadly, 10 times deadlier than the 2009 flu pandemic. Already there are over 123,000 deaths globally. We know that the virus can spread more easily in crowded environments like nursing homes and long-term care facilities. We know that early case finding, testing, isolating, caring for every case, and tracing every contact is essential for stopping transmission. We know that in some countries, cases are doubling every 3 to 4 days, like in the United States." He said that, and I quote, "While COVID-19 accelerates very fast, it decelerates much more slowly," end of quote. In other words, the way down is much slower than the way up. What does this really mean? It means that control measures must be lifted slowly. For example, the strict curfew measures must be relaxed slowly. And yet, we must still curtail the outbreak. We cannot relax the social distancing measures all at once. Strict control measures can only be lifted if the right public health measures are in place, including significant capacity for contact tracing and testing. The key thing, Mr. Williams, is to transition away from restrictions in a manner that will enable suppression of transmission at a low level whilst enabling the resumption of some parts of economic and social life.
And I just want to interject here just to comment on something that she said, because as it relates to our situation, we know that the first case was diagnosed on the 25th of March, but the virus we know actually entered the country on the 18th. And so today we have gone clearly through 2 incubation periods, that is 2 14-day periods. And she mentioned that one of the things we learned was that this virus multiplies very quickly.
Yes.
So from the time the virus entered into our country on the 18th, we should have seen a significant increase in the number of cases here in St. Kitts, or the number of persons presenting symptomatically to our institution. But we were able to suppress the curve, that is, decrease the number of persons who were exposed to the virus by our interventions. And so I believe that we are ahead of the game, and I'm happy for that.
I want to add, Mr. Williams, to date we only have 14 confirmed cases, and we are also monitoring the number of persons who access care at our emergency rooms, at the JNF General Hospital, at Alexandra Hospital, even at Mary Childs and at Parkson. And basically what we are being told is that only about 2 to 3 or 4 persons show up at the renal or the respiratory section at the emergency room at the JNF on a daily basis. So we are not seeing an increase in number of persons presenting with respiratory symptoms for care at this time.
Dr. Wilkinson,
Yes.
why are we lifting restrictions at this time? Why are we easing the restrictions? We have seen the world over that some countries are extending their lockdowns. We're here in St. Kitts, we're easing the restrictions, as we would have heard in the Prime Minister's address. Now, what criteria are you using to advise the government with respect to easing restrictions?
Well, let me make some general comments first before I go to that. And that is that each government must assess their situation while protecting all their citizens, and especially the most vulnerable. And countries are at different stages of the outbreak. And so the stage where we're at as it relates to the outbreak is not the same as the United States or Italy or Barbados or Jamaica. So one can't just look at what is happening there and say we need to be doing the same thing here. Here, there has been an early action and implementation of a comprehensive public health measure, such as rapid identification and testing, and isolation of cases, a comprehensive contact tracing and quarantining of contacts. So we have suppressed the COVID-19 epidemic to such a level that it was not able to overburden our healthcare system. In other words, we were able to suppress the curve. We are, however, guided by the World Health Organization in our decision-making process. And the World Health Organization gave 6 criteria that countries should use to guide their decisions as it relates towards lifting restrictions. And I'll go through them for you. First, the transmission must be controlled. Dr. Laws,
yes,
what do you say about our
Mr. Williams, I want to underscore that the COVID-19 outbreak and the transmission of the virus locally has been controlled. Again, we've gone 28 days since the introduction of the virus into the Federation. That's the 18th of March to today, the 15th of April. We've only reported 14 confirmed cases, and we have not seen an increase in number of persons accessing care with respiratory tract symptoms.
And let me just clear something here, because we're not saying that we're not going to get more positives. But what we were able to do is suppress the curve such that even if we continue to get positives, they will be coming at such a low rate that our health system can take care of them. Okay? The second criteria is that the health system capacities are in place to detect, test, isolate, and treat every case and trace every contact.
And I want to confirm that this is so. The health system capacities, all right, so we have a minimum of about 50 beds available for confirmed cases if the need arises. So far, only 2 of our patients have been hospitalized for about 2 to 3 days. All right, and so the public health practitioners, we are on the road every day, detecting, we are interacting with the contacts. To date, we have made contact or reached all the contacts of the 14 confirmed cases. There are about 160 contacts of these 14 cases. And so the public health practitioners, St. Kitts and Nevis, we have reached all of these 160 contacts. Most of them have been sampled, and most of these samples have been sent off for testing. Okay?
And thirdly, they want us to ensure that the outbreaks and risk are minimized in special care settings, like in our health facilities, nursing homes, prisons, etc. And
again, in terms of the carding home, the prison, we've
or the private nursing homes,
or even the privately run nursing homes, because we are in touch with them. Visiting these entities have been restricted for a couple of weeks now, and we've made this recommendation in order to prevent the introduction of the virus into these vulnerable settings.
Fourth, that preventive measures are in place in workplaces, schools, and other places where essential services are offered.
And Mr. Williams, it is with pleasure that I remind you of the work that Mr. Abdias Samuels and I and other members of the NEOC task force, we conducted a very comprehensive education campaign starting as early as about February, where we went into public and private entities, educating employees and everybody in terms of this virus and the outbreak.
We actually went into every school also.
Yes, oh yes,
we carried the message to every school.
Precisely.
And all the private
and the Ministry of Health collaborated with the Ministry of Education and the St. Kitts and Nevis Medical and Dental Association in so doing.
Fifth, we need to ensure that the importation risk is managed. In other words, the risk of the virus coming into a country from outside is managed.
And as far back as March 25th, we closed our borders, airport, seaport. And so this was very effective. And I want to add, even prior to that, we increased surveillance at our borders. And so persons coming in from high-risk areas, they were screened and placed into quarantine based on their risks.
And the sixth and the last criteria that they put forth is that communities are fully educated, engaged, and empowered to adjust to the new norm. And
that's why we are here this afternoon, engaging the public in terms of providing them the latest information about the virus, about the outbreak, and we want to share with individuals what's going to be expected with respect to the new norm. I don't think life will return to how we knew it. It's going to be a new normal. And so that's where the discussion needs to be now.
And just one more point about these 6 criteria here, because it is not necessarily a checklist that countries need to have filled out, but guidance. But here in St. Kitts and Nevis, we have checked every single one, in that we were so ahead of the curve in terms of what we were doing that we have accomplished all of these. I was looking at CNN just last night, where one of the commentators were indicating that even the first one on the list in terms of making sure that the transmission is controlled, the United States was not there as yet because they're still having rampant outbreaks. And so we can comfortably say that we have achieved the 6 criteria that the World Health Organization put out, so that we know that we can comfortably start thinking about easing some of the restrictions that we have on our people.
Now, Dr. Laws, who do you think have been the most impacted in our society by this pandemic? Who have been most affected by it?
Thanks again, Mr. Williams, for this question. COVID-19 has taken a huge toll on individuals, families, communities, and it has impacted all of our society, the entire society. It has caused widespread social and economic disruption, you will agree. The public health and socio-economic impacts have been profound, and it has disproportionately affected the vulnerable. Like St. Kitts and Nevis, every country should be implementing a comprehensive set of measures to slow down transmission and save lives, with the aim of reaching a steady state of low level or no transmission. This has to be done while at the same time considering the socio-economic impact on the country. There is a subset of persons in our society who can only earn by being on the job, unlike some of us who have a check coming in at the end of every month. This is a very important question. How do you survive a prolonged lockdown when you depend on your daily labor to eat?
And that's an important question, because we could put draconian measures in place and say, let's lock down the country for 2 months and eradicate the virus. But how are persons who depend on their daily going out to work to get food, how are they going to survive? And so we have to think about our farmers, our fishermen, our gardeners. We have to think about the persons in society who don't have a check coming from government or private institution, whether they stay home or not. And so we must attempt to strike a balance as we move forward.
The construction worker earns by going on the site daily to earn. Yeah.
Now, Dr. Wilkinson, to date, we have 14 confirmed cases of COVID-19. We have 0 deaths.
Thank God.
And we also have 0 recovered persons from the virus, the COVID-19. Suppose we were to get to a stage where all 14 cases of COVID-19, that they would have recovered, and that we are at 0 in terms of no cases at all in St. Kitts. We are COVID-free. Does that then mean that the mission is accomplished and we can get back to normal and start doing all that we were accustomed to doing before.
The last person I heard say mission accomplished and suffered because of that was President George Bush with the Iraq War. And so I would not advise saying mission accomplished at all. But as was just said, every country should be implementing a comprehensive set of measures to slow down the transmission and save lives with the aim to reaching a steady state low or no transmission at all. And so right now we are at a steady state low where ever so often you hear we have 1 or 2 cases, but we have not had any significant spike in the number of cases. However, because of our global connectedness, it means that at some point in time, for example, if we open up our borders, we can reintroduce the virus again into our community and have a resurgence. And we can't close on our borders forever. After the disease has been controlled in other countries, there might be nationals who want to come home. We can't tell them that they have to stay out there 6 months, a year, 2 years while we try to get this thing under control. But where the solution is going to come is if a vaccine comes on board. And that's why most of the experts around the world, they are working on a vaccine, and we will try to keep our figures suppressed to a very low level or 0 if we can attain that while we get time for the vaccine.
I want to add, Mr. Williams, I want us to understand that we are now at 14 cases. However, because this virus is new to St. Kitts and that we do not have, or people do not have immunity against the virus, we will continue to see a rise in the number of cases. But the important point is we need to make sure that we contain it and maintain low numbers. Numbers should remain as low as possible so that we do not overwhelm the health system. So we are going to continue to see an increase in the numbers, and then we will peak, and then we will come down the curve as you understand it. Yeah? So I don't want you to think that it's just 14 and then they will be recovered and then we would go to 0. That will be giving the false impression.
Yes, and it's important for the public to hear what we're saying, because even before we had our first case, we kept saying it was only a matter of time. Yeah. Okay, and it came. And the most important thing was we were trying to contain this disease so we don't have rapid spread and a significant rise overwhelming our healthcare system. We've gone 28 days now, and we're pretty certain that we have lowered the curve and contained the disease. But there are a number of things that can cause a resurgence again, and we're trying to make sure we keep these measures in place.
Yeah. We are trying to avoid an exponential increase in the numbers, whereby our resources is overwhelmed. Yeah?
Now, Dr. Laws, you mentioned overwhelming the health system. And what we have seen in many countries, even in developed countries around the world, is that their healthcare systems have been overwhelmed. We have seen doctors and nurses and others, health professionals, working overtime, overburdened, tired, having to protect themselves, of course, from contracting the virus. Some of them have even died on the front line. Now, is this pandemic just a concern for health workers?
Mr. Williams, no. However, they are important in terms of our fighting this virus. This pandemic is much more than a health crisis. It requires a whole of government and a whole of society response. The resolve and the sacrifice of our frontline health workers must be matched by every individual and every political leader to put in place the measures to end this pandemic. We are all in this together, and we will only succeed together. Everyone in society has a part to play in building the capacities required to control this pandemic. The singular focus is on working to serve all people, to save lives and stop the pandemic. We must do everything we can to stop cases from becoming clusters and clusters from becoming explosive outbreaks. We must engage everyone in this response.
And that's why, as Hazel said, defeating this virus is our singular focus right now. And while we seek to engage the whole of society in this effort, I want to here again publicly thank all of our frontline workers for the sacrifice they're making. While we made an oath as doctors to serve, we also have a moral responsibility to go beyond the call of duty in this crisis. And I am proud that all of our young doctors and nurses are committed to this effort and that they have stepped up to the plate. And I want to say thank you to all of our doctors and all of our nurses and all of our allied health workers. And I know in extending this thanks, I'm talking for the entire nation. So I'm telling them now, the entire nation appreciates your work, and we want you to continue to do this as we continue to fight this dreaded disease.
As the Chief Medical Officer leading this effort, I want to endorse that commendation. I want to publicly thank all our frontline health workers for their contribution to this fight so far. We are all working tirelessly every day. I encourage each and every one of us to continue to work together as a team with the singular focus now at continuing to contain this disease. I also publicly thank you for your service to our nation.
Dr. Laws, Dr. Wilkinson, we're hearing a lot about an all-of-society approach. I recall that former Prime Minister of England and the first female Prime Minister of England, Margaret Thatcher, said there is no such thing as society. Society does not exist. What exists are individuals and families. Now, to break that down, this society is made up of individuals. We're a community, we have families and so on. Can you spell out the role of the individual, the community, and the government? Okay. What role do they play?
Well, I'll speak to the individual first, because individuals have a responsibility in that they must protect themselves and others by adopting behaviors such as hand washing, avoiding touching their face, practicing good respiratory etiquette, and individual distancing. And so they have a responsibility in doing those. They must isolate themselves in either a community facility or at home if they are sick. And so the days of you being the macho man or macho woman coming to work because you're sick, those days are over. Persons must take responsibility in terms of checking their temperature. Don't wait for the government to come and put a policy in place to say you can't enter a certain establishment because you have a fever. You can check your fever at home. I remember as a child, before I went to school, my mother would always come and she would put her hand on my neck like that to see if I have a fever. But now we have thermometers at home, and so persons can invest in a thermometer, and if they realize that they have a fever, they can make a decision not to go to work and stay home and call their healthcare physician to see if they need any further treatment. Persons also have a responsibility not to abuse this, because coming out of this, you might find that persons, they might call into a job and say, oh, I have a fever, I can't go to work. And so that's where personal responsibility comes in. Also too, if you were contacted by the healthcare officials saying that you were a known contact, don't make it difficult for us to chase you down. You need to present yourself. Go and quarantine yourself until we come and give you the necessary information. Persons need to cooperate with the physical distancing measures. So, for example, the Prime Minister mentioned about Thursday and Friday and the zoning, and the police should not be overwhelmed trying to tell persons, you are from zone 1, you should not be in zone 2. These are personal responsibilities that persons need to take. Persons need to take the personal responsibility in terms of avoiding mass gatherings, going to churches. Next week, when we open up the country some more, I believe we have enough coastline so persons can go to the beach, but yet not gather in crowds. And so there are a lot of things that persons can do. We have a new norm now where, for example, even with our meetings, we meet virtually. And so if you can continue this virtual meeting, those are things that you can do as an individual to prevent the spread of the disease. And so each person has a significant personal responsibility in controlling this. I believe that the government, the ministry, we have done quite a lot, but you can undermine every single thing that we have done if you don't take that responsibility.
All right, so Mr. Williams, let us discuss the role of communities. Firstly, the communities must be empowered. And so that's one of the reasons why we are, having this discussion this afternoon. The aim is to share information. It was Thomas Jefferson who said knowledge is power. Now, critical functions such as community education, protecting vulnerable groups in the communities, supporting health workers, case finding, and contact tracing with physical distancing measures can only happen with the support of every part of affected communities. So now let us speak to some other communities.
Just before you go on there, I just want to interject here, because as it speaks to the community at large, what I want to tell our communities here, the same way, for example, in the village, people rally and support the village football team, or in Newtown, the Newtown football field team. Communities need to take responsibility. So you can decide, I am going to do everything I can to keep my community COVID-free. Persons in Sandy Point can decide that they're going to make sure that Sandy Point is one area in St. Kitts where we would not have any clusters by their individual action and their actions as a community itself. So those are things, but you can continue.
Yes. For example, the church communities. You and I, we know that church involves a congregation of members and sometimes large numbers of individuals, and this can facilitate the spread of the virus. And so we want to appeal to the church communities in terms of what are some alternate means by which you can foster, praise and worship using technology, live streaming, etc. And so we also want to appeal to the transport sector. For example, the bus operators. Now that's a very important service. There are a number of persons who move from the west to Bastia, the east to Bastia, utilizing public transport. And so the bus operators, we are appealing to them. How can you provide this service and still prevent the spread of this virus? So for example, can you consider operating at 60% capacity? For example, instead of 14 passengers, why not 8? And is it possible for the bus operators to allow passengers to sanitize their hands before entering the bus? And again, passengers utilizing public transport should wear a face mask, all right? So you need to sanitize your hands, make sure you have on your face mask, and then you sit, a distance away from the other passenger. And then you utilize hand sanitization again when you exit the bus.
Can I just mention something about the buses also? Because the new norm might be when you're traveling on the bus, instead of the busman having the air condition on, since we are concerned about droplets traveling around in the air, you can open the window and the lovely country breeze can refresh the air circulating there and decrease your risk. And so the new norm might be driving with your windows down.
Without the air condition.
Without the air condition.
Yes. And I need us to remember that St. Kitts is small and the bus routes are not very, long. It's about 10, 15 minutes, really. And so these measures can reduce the risk of spread of the virus by utilizing public transportation. All right, and so these are just some considerations for bus operators. I also want to consider private sector businesses and public sector offices. These are some entities that provide services to the general public. And so the new norm should entail having hand hygiene stations at the entrance to these facilities. So that's a recommendation from CDC, WHO, the availability of hand hygiene stations at the entrance to these entities. And the Prime Minister in his address a few minutes ago mentioned the need for temperature checks in terms of individuals going into private sector businesses using the infrared thermometers, and temperatures above 99, individuals can then be directed to their healthcare provider. Now, again, the businesses and the public sector offices also need to look at their staff members. How many staff members should be allowed at work on any particular day? Some offices, based on the layout, would have had 10, 12 persons in cubicles. However, with the new social distancing recommendations, each entity needs to consider, okay, how many employees should or can come into office at any given point in time. So that's a consideration going forward. And by extension, how many clients and customers should be allowed in the entity at any given point in time. Again, you need to look at the need to have 6 feet between persons in making this determination. And of course, staff and clients, customers should also be wearing the face mask. So these are just some considerations for the various communities to which I referred.
Did you speak about government?
Yeah, but let me say the government. What does the government have to do with this? The Constitution, Chapter 2 of our Constitution, the protection of fundamental rights and freedoms, tells me that I have a right to my freedom of movement. It is a fundamental right, and the government, the role of the government is to protect that fundamental right. So why it is now that the government is restricting my freedom?
Well, continue with the...
Well, Mr. Williams, it's because of a very serious public health issue. Yes, and so that I think that may trump your right.
Health and security.
Yes.
Health and security trumps everything.
Your right, yes.
Health and security trumps everything.
So even though we have those rights, I mean, those rights can be curtailed, those rights can be limited on the special circumstances.
Circumstances, yes.
But what else does, what other role does the government have? I mean,
well, the government has a role in trying to coordinate all of our responses, and so you see, for example, where we're at here, we had several $1 million being injected into the healthcare system so that we can get to a level of preparedness. And so that comes from the government. The government might have a role in enforcing social distancing measures, etc. You saw when the supermarkets were being bombarded with persons, we had to call upon the armed forces to enforce the social distancing. And so government has a role in coordinating all of these efforts. And it's important for governments to be able to work across party lines, because this is a crisis, and so it doesn't matter what is your political persuasion, what is your race, what is your gender, what is your creed. This is a time when everybody needs to unite to deal with this pandemic.
Now, Dr. Wilkins, you mentioned in terms of race and age and gender and all of that. Now, you went on record today to state that there is no requirement to provide the age, the gender for persons who would have been confirmed with COVID-19. What is your rationale for this?
Well, what I said was going forward, we would not be given all that information because first and foremost, we have to think about persons' confidentiality. And we live in a small community. When I lived in the United States, I take off my white jacket, I step outside the hospital, and no one knew me. I was just another person walking in the street. Here, in this very small environment that we live in here, people know persons. And so when you give a significant amount of information as it relates to the race, the age, the gender, persons have been tracking down persons and doing some of the worst things that you would not expect people to be doing in an epidemic like this. You know, putting persons' pictures on Facebook, etc. Sometimes they've put the wrong picture. Now, what are we to do? Call and say, oh, that is the wrong person, so that when they have the right person, we say, oh, you have the right person. And so we need to protect persons' confidentiality. When you get the figures out of Italy, New York, etc., you get a figure. You get a number. You don't get any details as it was a black man aged 25 living, in Harlem. You don't get that kind of detail. But what we would do in time is provide the data so that persons can look at their trends. And so maybe at the end of a month, etc., we would say of the 14 cases, they were divided by age, sex, etc., so that persons can look at their trends. But we are trying to protect persons' confidentiality. And for all those persons out there who are saying, yes, we should give this information out, you would say yes until it is you, until it is your mother, until it is your father. And sometimes persons only understand the severity of a situation when it touches home. But we need to protect every single one. I know what some of these persons went through when persons tracked them down to find out who they were, and we need to protect that. We need to look out for everyone.
Now, the World Health Organization is at the forefront of trying to coordinate this global pandemic. Has several global strategic objectives in trying to address the pandemic. Can you briefly summarize what some of these objectives are?
I'll start out because there are actually 4 main objectives that they say we need to address. And I can tell you that here in our federation, we have been addressing these 4 main objectives. The first one says mobilize, in that we need to mobilize all sectors and communities to ensure that every sector of government and society takes ownership of and participate in the response and in preventing cases through hand hygiene, respiratory etiquette, and individual level physical distancing. And so we are trying to mobilize all sectors of society in this effort.
I want to say, Mr. Williams, that we are experiencing success in this regard because we are right here at the NEOC, and the government, has been successful in engaging all the government ministries and departments, and there is buy-in, and they are all intimately involved in the response to COVID-19.
The second is control, and we need to control sporadic cases and clusters and prevent community transmission by rapidly finding and isolating all cases, providing them with the appropriate care, and tracing, quarantine, and supporting all contacts. And we have been doing that from the onset. That's one of the reasons why we were able to lower our curve and prevent ourselves from overwhelming our healthcare system.
To date, we've been successful in preventing community transmission. There was a PAHO meeting earlier this afternoon, and the director, she confirmed that none of the English-speaking Caribbean member states are experiencing community transmission at this time. And so I wanted to underscore that point.
Hazel will continue with the others.
Suppression. All right, and so another of the objectives is to suppress community transmission through context-appropriate infection prevention and control measures, population-level physical distancing measures, and appropriate and proportionate restrictions on non-essential domestic and international travel.
And I just want to interject here, because when we say non-essential domestic and international travel, and so for the time being, if you live in the village and you don't have to go into Newtown, don't go into Newtown. If you live in Sandy Point and you don't have to go to St. Paul's, don't go to St. Paul's. So try and restrict your travel. And so the same way we were calling upon us very early to close down our borders, you need to close down the circle that you move in also, so that you don't move this virus across our country. It's a very small island, and it's very easy for it to be overwhelmed if we don't take the personal responsibility in controlling the spread.
And then the other objective is to reduce mortality by providing appropriate clinical care for those affected by COVID-19, ensuring the continuity of essential health and social services, and protecting frontline workers and vulnerable populations. And so the aim is to reduce mortality. And we are lucky so far in that the 14 cases have all been just mildly affected, but we need to make sure everything is in place such that we do not have any deaths.
And just one last point I want to make here, Lesroy, because you spoke about the fact that we have 14 cases and the 14 cases have not recovered as yet. And that is because we have a very stringent program in place before we declare somebody recovered. If you look at in the United States, once somebody, for example, has gone 72 hours without any symptoms, you might hear them saying that they're recovered. But because we know that the virus, even though you are symptom-free, can still be present at very low levels, and although your ability to transmit the virus might be low at that point in time, our policy is to wait at least 14 days after you have no symptoms and retest you and see if you get 2 negative tests. And so we have not proclaimed anybody recovered as yet, although they're all doing well.
Because there's a chance that individuals can experience relapse. Yes. And so we have to be careful in so doing.
Right. Now, that's an interesting point you made, Dr. Wilkinson, because in places like China and in some other places, some people who were deemed to have been recovered, then they start seeing them coming back with symptoms.
Yes.
Is it that they are reinfected, or is it that the virus is reactivated?
We don't think that is they're reinfected, because generally speaking, when one is exposed to a virus, you develop immunity, even if it may not last forever. And we believe that some of these persons might be persons who they were recovering, the virus level dropped to such a low level, but their immune system became compromised and the virus multiplied again. And
so it was reactivated. They were not reinfected.
That's what we believe. But of course, this is a new disease.
And we're
only 3-4 months into it, and we're still learning. And so when the tale is told a year from now, we would have more information on that.
Okay. Well, I want to thank you so much, Dr. Laws and Dr. Wilkinson. From the time that it was announced that there was an outbreak of COVID-19 in Wuhan, China, the federal government and the ministries of health on both islands started their preparedness plan. In fact, in my last interview with you, which we had at the Joseph and France General Hospital, I saw the hospital and the level of preparedness that was there. So I can speak having first-hand knowledge of that. Fundamental to the right against this deadly virus is personal responsibility, which you spoke about, and taking certain actions to prevent its spread. Keeping the public updated and educated about this disease is therefore germane to our success at defeating this pandemic. The St. Kitts and Nevis Information Service has been having a series of interviews hosted by myself, with you, Dr. Wilkinson, Medical Chief of Staff at the Joseph and France General Hospital, and you, Dr. Hazel Laws, Chief Medical Officer. In order to get this message across, Dr. Wilkinson, we made a promise, or you made a promise, to leave no stone unturned.
We all made that promise.
We all made that promise. And in terms of getting the information out, so that there can be no information vacuum, we have repeatedly stressed the importance of the nation coming together, united in a common purpose to eradicate this virus from our federation. Music unites the world, and we thought we would use our voices to get the message out and unite the nation in song. I want to make a few disclaimers. Dr. Laws claims not to be able to hold a note and admits to stepping out of her comfort zone with effort. Dr. Wilkinson said that from the age of 5, when he started primary school, he was labeled a non-singer and was forbidden to sing even in church. We, however, would like to thank them for the composition and thank them both for everything they have done so far to keep us safe. Now sit back and listen.
Ladies and gentlemen, may I present Team COVID-19. Step into the mic in the studio is Dr. Laws, our beloved CMO, Medical Chief of Staff, Dr. Wilkinson, and Mr. Lesroy Williams, Team COVID-19 on the front line, coming to you in Calypso rhyme. So sit back, relax, and listen to what they have to say and the role they want you to play. Easy!
Early in January this year, our federation woke up in fear because a little virus out there in Wuhan was slowly making its way to our land. They say its name was SARS Corona, and our lives it planned to devour. So we're here to come up quickly with a little plan to save our beautiful nation.
If it's a plan they want, then plan they will get. Because of people's lives we have to protect. Close down the airport and send back them big tourist ships so we could focus on this pandemic. Mr. MCS, I'm begging you please, as I pray to God from down on my knees. Now let's get all our hospitals and staff in order to battle this corona.
Well, Madam COO, I hear you loud and clear. We will win this fight, don't worry, don't fear. I'll sound the alarm and get all hands on deck. This war we will win and our people protect. To win this war we must flatten the curve. But don't overwhelm the nurses and doctors. Personal responsibility you must take indeed if we are to succeed.
Cover your mouth, we say cover your nose. This will stop the spread to those who are close. Lock yourself inside during the curfew. Under quarantine, to thine own self be true. Wash from your elbows down to your hands. With soap and water, it's a simple plan. If you follow these simple instructions daily, from this virus we'll soon be free. Easy! Now I know what you're thinking, but I only assisted with the recording. This song is not my composition, but brought to me by Dr. Wilkinson. Between Hillis Roy and the CMO, they've come up with this great kaiso. So after whipping COVID-19 behind, there'll be Sugar Mass 49. Easy! Gentlemen, may I present Team COVID-19. Step into the mic in the studio is Dr. Laws, our beloved CMO, Medical Chief of Staff, Dr. Wilkinson, and Mr. Lesroy Williams.